Okay, we'll call the November 5th Board of Commissioners meeting to order. Join me in the pledge to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Well, thank you, everybody, for coming. I got a few words I want to read before we move on with our agenda. First of all, I want to encourage everyone who has not yet voted to go to your precinct and vote. The polls will be open until 8 p.m., so you must be in line before 8 p.m. But once you're in line, you will get a chance to vote. In-person absentee voting at Carver County Government Center ended last night at 5 p.m. If you want to vote today, you must go to your precinct. A new Minnesota law has extended the deadline for absentee ballots to be dropped off at the Carver County Government Center until 8 p.m. tonight. If you have an absentee ballot, don't take it to the post office because it will be delivered to the county after 8 p.m. And that's the deadline, and thus it won't be counted. A new 8 p.m. deadline for absentee ballot to be dropped off at the Carver County Government Center is expected to delay the county's first posting of election results on the Minnesota Secretary of State's website until at least 10:30 p.m. You may have heard about a lawsuit over Hennepin County not having any election judges from the major party list on their 24 absentee ballot board. Carver County's 2024 absentee ballot board has had and will continue to have party ballots when required by law, and has had and will continue to have party balanced election judges from the major party lists. There's two things that these absentee ballot boards do: perform ballot duplications, and we've had 50 ballot duplications through October 27th. And they verify signature verifications, and we've had 23 of those. They work on the 2024 absentee ballot board when absentee envelopes are opened and absentee ballots are processed and inserted in the high-speed tabulator. At the last Carver County Board of Commissioners meeting on October 22nd, several Carver County residents expressed their concerns about Carver County's compliance with election laws, and last week concerns were raised about sample ballots on the Minnesota Secretary of State's website. Our Carver County election staff has listened to numerous concerns raised by the public throughout this election cycle, and has and will continue to work to clarify with the county attorney's office to ensure Carver County is following all election laws. If you have any questions and or concerns about Carver County following election laws, please email Mr. Dave Frischman, our Property and Finance Director, who oversees the Election and Licensing Department, at dfrischman@carvercountyminnesota.gov, or call his office number, 952-361-1506. And with that, we'll open it up to public comments. If anybody has a comment they'd like to share with the county board this morning, now's the time. Please come up to the podium, identify yourself. Yep. No, you can go either way. You podium, or if you feel more comfortable sitting, that's fine too.
My name is Katie Lohman, and I'm here to talk about some things I feel need to change in Carver County about child support laws and how they're enforced. Child support is something that every single parent has the right to have. That is why most parents going through a divorce spend a ton of money on divorce lawyers to make sure all things are done correctly and you have a legal binding divorce decree to follow, something you can take back to the court system to have enforced by the law with punishments if not followed. Minnesota law has statutes for non-support of child or spouse, and those laws are in place, and they go all the way up to a felony level. In Carver County, I have found painfully that those statutes and laws are not followed. And I have printed those off if you would like to see them, and I have one for all of you if you would like.
Yeah, please, if just,
Can hand it to Dave.
yeah,
and he
give
can
it to the
describe
county administrator, and he will make sure we get a copy.
Thank you.
Thank you.
The felony level says that if the non-paying parent is greater than 9 times what their monthly support is supposed to be, they are at the felony level. Just for your reference for what I'm about to talk about. I am reaching out in a state of desperation and frustration. For the past 3 years, I have implored Carver County for assistance with my child support situation to no avail. Despite my efforts to enforce basic measures such as license revocation, in-person hearings, and the issuance of a warrant after accruing over $25,000 in arrears, my pleas have been ignored. My ex-husband has not maintained employment for more than 3 months at a time over the past 3 years. He has learned to evade the system by quitting his jobs within the 3-week time frame that it takes the county to begin withholding his earnings. The situation escalated when Carver County Attorney Jennifer Cooklock informed my ex-husband via email about an impending warrant, which led him to leave Minnesota before it took effect. I have repeatedly requested the pursuit of felony child support charges only to be told by my child support worker, her supervisor, and the county attorney that, quote, Carver County hasn't pursued such charges in decades. We don't do that in Carver County. Now, with my ex-husband at $51,466.29 in arrears, I am behind in child support. I have been compelled to seek EBT and heating assistance. If he were contributing even minimally, I would not require this aid and could afford basic necessities for me and my children. I urge you to advocate for legislative changes to address cases where individuals evade county enforcement and neglect their financial responsibilities. The current system, with its ineffective bench warrants and lack of stringent consequences, allows such parents to simply flee the state, leaving families like mine in financial distress. This is a form of financial abuse, affecting not only me, but also our children, continuing the cycle of neglect and hardship. It is imperative that the county and state takes decisive action to prevent this type of abuse and provide the necessary support to affect families. No one should be left to endure this struggle alone. Since October of 2021, I have received only 21 out of 108 potential payments. I had to insist vehemently for our first court appearance for contempt on December 14th of 2022. By then, my ex was already at $14,728.87 in arrears, which was already at a felony level. Strict rules were set for him to follow until the next hearing in March. He was ordered to pay less than half of our court-ordered child support payments. 3 days before our next hearing, when I contacted my county worker, suspecting that Scott had already quit his job because the payments kind of got less and less, the last 2 payments were less and less and had gotten suspiciously close together, she told me that her and the county attorney had decided to cancel this hearing because he had made his payments up to this point. He was doing well. Well, guess what? 2 days later, he had quit his job. He had moved from where he was. He had changed his phone number, and poof, he was gone. Since 2021, he has moved 12 times across 4 states and has had 6 different phone numbers that we know of. The next hearing was July 18th of 2023, by which time he owed $22,020.68. Again, way past felony level. Scott lied to the judge about an inheritance that was coming that would clear all arrears by early August. He was ordered to report to jail by August 4th if this had not been fulfilled. On August 14th, at yet another hearing, which Scott failed to attend and was not in jail, the amount had reached $25,571.03. A warrant was to be issued on September 29th. If Scott did not make the normal payments for August and September, he did not comply. But September 9th came and went, no warrant. I had to persistently contact the county attorney to issue it, and then she notified Scott via email that the warrant was forthcoming in 2 days. Scott was living in Waconia at this time. We knew exactly where he was. Since he got notification of the warrant coming, he packed up and left Minnesota and has not been back. He did not even return for his father's funeral just a few months ago. Carver County must adhere to the state's laws and legislation. They exist for a reason. While the laws may not become stricter, ensuring their enforcement is crucial. There should be also a clear accountability system for Carver County or a hierarchy outlined on the county courthouse website. I have spent the past year trying to determine the appropriate contact for changes and to whom I need to speak to and whom I need to address when dissatisfied. After raising my issues to my county worker and to their supervisor without a satisfactory outcome, I sought the supervisor's information, to which I was not given any information. Inquiries to the court administration regarding dissatisfaction about the attorney that I was assigned remained unanswered. Direct communication with a judge was discouraged. Consequently, I approached my state House representatives and senators who have written me back, and that's how I got led to this meeting, to contact all of you.
Take a deep breath. Hopefully you're just about done with.
Yes.
Okay.
Should this avenue not yield any desired results, I will continue to reach out to House representatives and senators and try to get changes done there. But there needs to be clear hierarchy on the website, because literally you go on there, you don't know who to go to. There's nothing. You can type in complaint and all you get is like warrants, that type of complaint. There's nothing for who is your county worker supervisor, who is the supervisors for them, who do you go to if you're unsatisfied with the attorney you're assigned, because you don't get to choose, they're just given to you. You don't know who to go to. It shouldn't take this long to have something done. It shouldn't take this long to be able to come to all of you and say, hey, this system is screwed up. And honestly, he now, with owing me $51,000 and he's gone, we'd have no clue where he is. And I've had a bench warrant now for almost a year and a half, 2 years. It's absolutely ridiculous. And a bench warrant is worthless because now he's in another state.
I can commiserate with your issues, but this is obviously the first that we have heard about it. And we have both the county attorney and the director of HHS in the room. Hope they will at least talk to county attorney Metz.
Yeah, Mr. Chairman, I'm not personally familiar with your case, but I will speak with our child support attorney and we'll communicate with Health and Human Services, and our office will get back to you and address your concerns.
Thank you for bringing this to our attention.
Thank you for listening, and I truly do hope something changes because, like I said, this is absolutely ridiculous, and the felony child support laws are there for a reason, and they should be utilized, and they should be used, especially for cases like this where they're purposely evading.
Thank you for bringing that to our attention.
Mr. Chair, before you leave, I just want to make sure there's a way we can communicate with you, so share.
Make sure you give your
appropriately so
contact
we can make
information.
contact
Sure,
with you.
absolutely. How would you?
You can just write it down here. Your address and your phone number.
Thank you.
Anybody else would like to say a few words this morning, as soon as she is done writing her information down? Thank you and welcome. Pull that down, make sure, yeah.
Good morning, everybody. Happy voting day. I'm here in regards to election judges, and I'm so glad that you gave the statement at the opening of your meeting because it was not accurate. And it was so not accurate that we actually have it on Rumble, the 2022 election. There were two things that major party balance election judges were mandated to do in 2022 that we did not follow the law in Carver County. The first was that they had to verify signatures. It had to be election judges to do two things: verify signatures and duplicate ballots. And that was handed out, well, the duplicated, scratch that. We've got a short time period, so I'll just get on this. The duplicated ballots, we had two people that were Republicans. One did 0 signature verification out of 13,000. The other did a couple hundred at most. So number one, we did not follow that law. Number two, they had to duplicate the ballots, meaning if an absentee vote, like I have one here to drop off for a lovely lady with Parkinson's who couldn't get in, if that were to get rejected for some reason, that's needs to be duplicated. Somebody needs to figure out why it's getting rejected and figure out the intent of the voter. That was mandatory, that was done by election judges. We did not have any election judges when they ran all 13,000 ballots through the machine after 8 o'clock at night. We had 2 employees. So let's get that straight. Number two, as far as ballot board election judge ballots, we have the certification, which you'll probably not allow us to record this time, from 2022, where it has Kendra stating that we do not have election judge balance party. So I would appreciate it, even though you find it disrespectful, I'm pointing out the fact that we do not follow the law, and you keep claiming that we do. Well, I'm a cat, doesn't make me a cat. Now, in honor of Peanut and the overreach of government, I'm going to give you a little analogy here. About 25 years ago, it was really a big deal when we changed the laws in Minnesota. Before that, you could beat an animal to death, put it on the flagpole, whip it around, throw it on the fire pit. Nothing more than $50 happened to them, if anything at all. So they actually made it where they could maybe get $10,000 fine and maybe a couple months in jail. So I'm going to use an analogy here. I know you guys like my analogies. I'm guessing that you guys didn't have to tell your children, Junior, don't hit the dog with a baseball bat and crack its head open. I'm guessing that there was some sort of common sense there. Well, I'm going to equate that to the fact that we should have all eyes on the ballot. And the fact that you guys sit up there and say that we do when we don't is just, it's vomitous. Feeding water, same thing as the chain of custody. We just had the Secretary of State, Mary Kiffmeyer, if you didn't see it, I'll send you the little link, basically say that Simon says he doesn't get to make up the law. We get things from Mr. Frischman and Mr. Hemsey and Mr. Metz who write it, that we're following the law when we aren't. And you can't just make things convenient for you. I don't get responses to my FOIA requests. You guys as commissioners should be absolutely flabbergasted at that and not allow it. But you do. Just like you're allowing the Johnny to hit the dog over the head and break its skull open. I mean, to just not say anything is just, it's beyond belief. And as far as the argument about the nonpartisan employees. We have wonderful, wonderful employees, but it doesn't make them nonpartisan. If they vote, which they do, I think there's a case that recently hit the news again, and I think that was a very famous gentleman by the name of Pete Rose. Same principle applies. Thank you.
Before you leave, I either missed it or did you identify yourself?
I did not, thank you. I forgot. Jennifer Ray Chanhassen.
Thank you. Any other comments? Anybody else would like to share a few words with the board? Seeing none, we will move on with our agenda. Agenda item number 1.3, agenda review and adoption. And this morning, we're going to move 2.3 on the consent agenda to 5.0 on the regular agenda.
Move approval with the changes, Chair.
Motion by Commissioner Ruderman, second by Commissioner Fahey. Oh,
One comment, did you mean 2.13?
thank you. 2.13 to 5.0, yes. Good clarification. That's still going with a second?
Yes.
And a motion and a second. Any discussion on that motion to move 2.13 to 5.0 on the consent, from the consent to a regular session? Seeing none, all in favor of the motion, say aye.
Aye.
Anybody opposed? Motion carries unanimously. 1.4, approve the October 22nd, 2024 minutes.
Move approval, Mr. Chair. Second.
Motion by Commissioner Lynch, second by Commissioner Workman to approve the minutes as written. Any discussion on that motion? Hearing none, all in favor of that motion, say aye.
Aye.
Anybody opposed? Motion carries unanimously. Community announcements. Commissioner Lynch.
You already mentioned it. I just want to mention that it's election day, so I see the go get your red sticker. I, for one, am going to miss all the wonderful commercials.
You are for one. Yes, okay. Any other community
that's it.
announcements? Good point, good point. Any other community announcements? Commissioner Ruderman.
Mr. Chair, 4 years ago, the hot topic was policing, and I see a lot of things on our consent today where Sheriff Cameroon and his team, I see a couple members are in the audience today, have taken strides, and so I just wanted to mention those. I know you go through them on consent, and so took a lot of things to heed 4 years ago, made a lot of strides. I also see public health in the office, in the audience. Looking forward to that presentation. We always talk about the things that were the healthiest and the happiest, and all the things that we've got going on, but I think there's been a lot of great strides, communities of belonging and otherwise, to address the areas where maybe we're not improving as well as we want to or falling behind. And so we'll talk about those. And you've addressed a lot of those. I think there's a listening session in Cologne tied to communities of belonging, tied to the elections soon. So appreciate those efforts. And then marked progress, at least through my inbox. I've seen a number of our collective bargaining units move faster than we've ever seen, with better insurance rates than we've ever seen. And so if you're listening, a lot of staff members are online or in the audience. I think we're in a better position now than we were just 2 years ago. And so appreciate the speed in which we're doing and the diligence by our HR and some of those interactions. Thank you.
Other community announcements. Commissioner Workman.
Well, Mr. Chairman, Chanhassen High School football will be playing this Saturday, now well into the season, like Norwin Young America, who's somebody might talk about. But the vaunted St. Thomas Academy, I believe it's still at noon on Saturday at Osseo. So you would get to drive up to my lovely wife's old neighborhoods up there if you wanted to go see a game. She's uninterested. So, but the Gophers, I wore my maroon pants today. We're on a roll. The Gophers, what a month.
Are you heading out to Rutgers?
Nope, I have, but I am not. My season's kind of ending because I'm not going to be able to make the final home game, but we're having a lot of fun. And so wish Chanhassen, who lost a lot of good players from last year, quarterback, running back, and but here they are. And so hoping for good things, even though they had to get here through our Chaska Hawks. So thank you.
Other Commissioner Fahey.
Thank you, Mr. Chair. A lot of just local events taking place. The Cologne Hollanders Bingo event is this Friday. That's at the Cologne Community Center. That's from 7 to 10 o'clock that evening. Also, there'll be various veterans programs on Monday, the 11th. Just thank you to all our veterans and their families. The veterans program out at Norwood Young America is going to have as a guest speaker Carver County's Veteran Service Officer, Steve Walter. And that program starts at 9:30 at the Central High School. And that's always just a fantastic event. Also, the various library programs for teens in November. There's a lot of upcoming events planned on Tuesday, November 12th at the Norwood Young America Library. For ages 10 through 18, they're invited for a fun craft and birding session. So if you're interested in that, definitely go and visit your local library. And also, Night at the Museum on November 13th at the Wilkeman Heritage Center. We'll host the Night at the Museum on Wednesday, November 13th at 7 p.m. And that's located up on East Main Street in Norwood Young America. And as Commissioner Workman has stated, just congratulations to the Central High School Raiders. They're Section 4 AA champions. They beat Cannon Falls on last Saturday in Watertown. And it was great to see Heather there, and she's a big Raider supporter also. And they play this Friday at 7 o'clock at Orono High School. So thank you,
Yeah,
Chair.
football is really a topic this time of the year. And you mentioned the Veterans Day celebration. Chaska is also, Chaska Middle School West is having a Veterans Day celebration on November 11th at 8:40 in the morning. You should start out in front of the flagpole and then move indoors after that. So in Chaska Middle School West. Everybody, hopefully, I mean, if you're here watching the meeting, you did change your clocks a couple days ago. And usually the same time of the year that you change your clocks, you should be checking your batteries in your smoke detectors. That's kind of a yearly thing. So better check your batteries, better yet, just replace them. And also your fire extinguishers. Check when's the last time you had those recharged or checked out. So it's two things that kind of go together as the seasons change. So with that, that ends our community announcements this morning. Moving on to the consent agenda. This morning we have quite a few items on the consent agenda. I'll go through briefly, go through them. The first one is a pre-order for incident response vehicle from the Sheriff's Office. The second one is a Justice Program grant. Then we have a citizens monetary donations. We also have an approval of another grant agreement pertaining to traffic safety. We have a pre-order for more equipment from the Public Works. We have our local recycling grant. We have approval of a grant, another approval of another different grant, quite a few grants this week. We have a CUP in a rural service district. We have approval of the Charles Dalkey grant for the library, elimination of petty cash fund in the library. We have a right-of-way plat for Highway 13. We have a right-of-way acquisition for Highway 11. We have a HIPAA appointment. We have an easement agreement for County Road or Highway 18. We have training equipment purchases, a tree planting grant, construction agreement for Highway 41 and 10 project, a joint powers agreement for Highway 18, a construction agreement for Highway 18, a memorandum of agreement with SMAC, one of our unions, and finally we have our Health and Human Services and Commissioner warrants. Anything on the consent that should be talked about separately? If not, is there a motion to approve the consent as listed?
So moved, Mr. Chair.
Second.
Motion by Commissioner Lynch, second by Commissioner Uderman to approve the consent. Any discussion on that motion? Hearing none, all in favor of that motion, say aye.
Aye.
Opposed? Motion carries. Item number 3 in our regular session is a 2025 legislative priorities. Our County Administrator, Mr. Dave Hemsey.
Thank you, Mr. Chair. Good morning, Commissioners. This morning, I'm looking for your approval of the proposed 2025 legislative priorities. Of course, this is another step in a long process of input and deliberation regarding these priorities. So thank you for your assistance, especially thanks goes out to Commissioners Fahey and Uderman, who serve on the Legislative Steering Committee. I'd also note Tony Albright, I believe, is on Teams this morning. So if you have questions for him, he's our lobbyist, of course. I see Greg Anderson, the board chair of the CDA, and Allison Strike, the executive directors in the room. A couple of legislative priorities in housing. That was an intentional effort, obviously a priority for us, and an extended effort to the CDA to strengthen our coordination and relationship with them. So they're in the room also. Just about all division directors were involved in this process too, so thanks go out to them. I'm not going to spend a lot of time going through the details
Oh, shucks.
this morning. I know that it will break your heart. But I do want to summarize them. Of course, back on October 22nd, we spent a lot of time in a work session going through the details. We do have 14 on the list here, and of course, we have many more issues that we work on to try and tackle, and we have other strategies, including working with multiple professional organizations to tackle a variety of other issues. But these are the ones that have risen to the top. One of the common themes in the priorities is stated via this policy, and that is asking legislators when they're thinking about making decisions or perhaps revisiting decisions that they have made to support local decision-making authority at this local level, right here in the boardroom. And of course, the board is solid on this position, feels strongly, and it's filtered throughout, I think, just about every one of these legislative priorities that are listed, including directly with issue number 1, requesting that the state or perhaps even federal legislation is not that is not accompanied by funding. Please accompany that with funding or change the language. And there's quite a bit of legislation on the books that currently exists that we'd like to see changed too. In your packet, there's a number of just examples listed. Pretty easy to come up with hundreds of thousands or even millions of dollars that we're stuck with without commensurate funding. Employee relations, this has been a growing initiative at the state capitol, and again, sort of rubs against the overall policy of unfunded mandates. And what we're asking for here is please allow us to maintain our ability to run our organizations. Many have heard about this new legislation regarding earned sick and safe time, Minnesota paid family leave, MPELRA, which is a federal Minnesota statute related to public labor relations, negotiating staffing ratios. All those sorts of things make it extremely challenging for us to run our organization. So we're asking for some changes to that language to make it more manageable. Number 3, as I mentioned, working with the CDA, putting housing initiatives right up on the top of our list, trying to achieve increased availability of multiple dwelling options. And of course, a very complex topic that we'd like to come at with multiple angles. Every jurisdiction plays a little bit of a different role, which is why, again, I think it's really critical that we work together with CDA and others. More specifically, last session, the legislation was passed, and we appreciate the funding that came with local affordable housing aid called LAHA. The acronym is LAHA. However, that did not come with any application of funding for the administrative costs. So we're asking that unfunded mandate, that it's covered up to 10%. And again, jump in with questions if you have them. We can address those. Greenhouse gas emissions, a lot of work at the Capitol last year. In this particular area for this issue was pretty onerous, quite frankly, when it first came out. I'd like to thank our Public Works Director, Lyndon Robgent, for serving on a committee and being very actively involved in trying to change the language, or more, I think more specifically, trying to clarify what the statute really meant in terms of the application to our road projects. So we're asking in this particular priority that the requirements are attached with additional funding if they're going to require certain things within the greenhouse gas emissions area. Pretty common theme, right? If you're going to ask us to do something, please help us fund it. Again, funding. This one's a little different, however. The Metropolitan Council, of course, is a partner of ours, helping us oversee our regional parks. Prior to a recent change, the Metropolitan Council had laid out a plan to reimburse us for acquisitions, in particular, Lake Waconia Regional Park, to the tune of $4.2 million. Well, unfortunately, they've recently changed their practice, and they've said that they're no longer going to reimburse that. We were concerned. We knew that might happen. We were crossing our fingers, and unfortunately, it did happen. So we're asking that at least we're reimbursed for those dollars that we've expended on future acquisition and other land purchases, and other parks purchases. Number 7, related to Lake Waconia Regional Park. We're looking to move forward with phase 3, and of course, we've made some great progress. For those that haven't visited it, please do. We've now built a pavilion, worked on Coney Island. That's in good shape for folks to come visit. But now we're looking for an additional phase here to provide design, construction, et cetera, of a playground and other amenities. And we do have the matching money, so we'd look for that cost share from the legislature. Another parks item, and I think there's a couple funding items. I won't go through those in detail, but requesting that they provide funding to support what is, of course, a regional park system through the bonding bill, and then also through the legacy funding mechanism. There's actually one more. So operations and maintenance also. High priority on the list here. A few items under Health and Human Services. This one is does not meet medical criteria. And hold on a second, I need to get to my notes on this one. This relates to individuals that are in effect stuck in our state-operated facilities and shouldn't be there. We'd like to get them moved to a different kind of facility that isn't quite as expensive. And unfortunately, those aren't available as we'd like them to be, and that ends up costing us. In this case, we've cited over $500,000. So we're asking for some changes in that legislation. Child protection, another important topic where we're asking for solutions that were outlined on a working group on youth interventions. And thanks to Heather, who our Health and Human Services Director has worked on that working group. And you can see some of the changes that group has recommended. So the experts are recommending these changes. Min choice is another. A lot of these are a bit frustrating when you're trying to run the organization efficiently, and it seems like many of these types of legislative changes that come across just require so much additional staff work that seems unnecessary. And this might be, no pun intended, the poster child here related to child protection and health insurance provisions, where we feel there are a number of things that could be eliminated from the list of those employees that are working on these kind of things. And that's outlined in this particular item. Another child protection issue. This is a new one that came through the legislature last year, the Minnesota African American Family Preservation Act. Another good example of legislation that requires us to do many things, but in order to do those here, in this case, it's another $2.8 million to implement those statutory requirements. So we're asking for funding to assist us with those requirements, new requirements. So there they are again, Mr. Chair and board members. Not, again, an exhaustive list, but a high priority list for your consideration. I'm looking for a motion to approve those items.
Any questions and concerns? Commissioner Workman.
Nope, no concerns. Just was gonna Make a motion to approve.
Okay, we have a motion by Commissioner
I'll
Workman.
second that.
Second by Commissioner Fahey. Discussion. Commissioner Uderman.
Mr. Chair, I want to recognize that we do have our representation in the boardroom today with polls.
Oh,
and then-
Courtney showed up, okay.
And then
Courtney
also,
Jasper,
yep.
Hello.
Thank you for being here. And then also, you know, the CDA in the room, and they've led the charge a lot for affordable housing and workforce housing, et cetera. It's the first time we've added those to our legislative priority list. And it aligns with a lot of buzz that's happened at the Capitol, and we'll probably, depending on what the outcome is of the election tonight, we should have some movement to be had there. So huge momentum going on there, and a lot of work that goes into this. We just see the priorities when they get listed, and we share them with our lawmakers in January. But there's a lot that goes into this. So Commissioner Fahey, myself, others, and then other that have been a part of that group for a number of years. These are the things that we talk to when we go to DC or when we go to the Capitol, and this is where we make impacts for things that the Gallet shared today. In concert with our lawmakers. This isn't just voodoo that's happening behind the scenes. We're actually making some of these things happen. So thank you.
And these are some of the choices our other government, our county organizations, we're all dealing with the same issues. AMC on the board of directors are coming up with a list of priorities. And some of the ones that we as a county, specifically other counties, the whole organization are going to tackle at the legislature because especially in the HHS field, all the counties in the state are dealing with some of these same issues, and we need some help. If they're going to demand that we do this stuff, which we are, they should provide some of the funding or support for it. So, any other questions, concerns? If not, we have a motion and a second. Any other discussion? Hearing none, all in favor of the motion, say aye.
Aye.
Anybody opposed? Motion carries unanimously.
thank you, Mr. Chair. Just a final note, legislative breakfast, Tuesday, December 17th, 7:30 to 9:30 at the Chan Legion. As we always do on an annual basis, I neglected to mention, those are our partners, right? So it's so important to build those relationships and get them to understand our needs. So we'll look forward to seeing you there.
So that's the next step on carrying out these legislative priorities.
Yes, sir.
Thank you. And with that, we come to where we have to recess as the county board, adjourn as the county board, and
Convene as the Carver County Regional Rail Authority.
well
So moved,
said.
second.
Motion by Commissioner Lynch. Is there a second?
Second.
Second by Commissioner Fahey. Any discussion on that motion? Hearing none. All in favor of that motion, say aye.
Aye.
Opposed? We are now acting as the regional rail. Mr. Walsh is our Parks Director.
Thank you, Mr. Chair. Also here representing the Southwest Trail Association in the audience is Scott Wakefield, so I'll ask him to come out here in a few minutes to fill you in too on their work. So this is actually the second time the Southwest Trails Association has asked for a permit to be on the Dakota Rail Corridor. It was due to a gap in the trail system that occurred a couple of years ago. And the requested area is essentially from the county line to near County Road 32. For those that aren't familiar with the area, that's in the area of New Germany. New Germany. And the Dakota Rail Trail long-range plan, if you will, did have this consideration for the possibility of issuing or providing snowmobiling on that corridor. I know this map is large, if you will, in terms of the area that it covers. But again, off on the far left-hand side of that map is near the county line of McLeod County and Carver County. And then as you can see, there's kind of a pink highlighted line that leads virtually straight, that's along the railroad corridor, right into New Germany. And then at the far right-hand side is where County Road 32 is. And then the trail diverts off of County Road 32 going north onto private property at that location. So in general, that's the area that we would be issuing a permit for. There's also a dashed green line going south about where the school is there in New Germany. And that too also goes off of the regional trail corridor and then onto private property. So the Park Commission did at its last Park Commission recommend issuance of a permit to the Snowmobile Club here. And with a number of conditions here, I won't go through all the conditions that have been placed on here, but generally, the Snowmobile Club is responsible for signing, operating within assigned hours, has speed limits through town. They are protecting the bridge structure and on the far west end at Crane Creek. And I'll just mention that bridge structure is currently, in a state of needing repair. And we've had some difficulty, what I'll say is completing plans due to the high water level that we experienced all summer long. We weren't able to do additional investigation. I was visiting with the bridge designer yesterday about when we think we might be able to actually bid the project. So we have the additional investigation work going on. We want to proceed as soon as we can when the conditions allow us to do that. But it's gonna, our construction window here at this time of year is closing fairly rapidly. So we may be able to permit the Snowmobile Club to be on the entire stretch, but if conditions would allow us to proceed with construction, because it's in an area where it's wet, and if we get, large snow and heavy rains, if we can get work done this fall, we will try to do that. But if we can't, and again, it looks like it's gonna be pushed off until spring, we want to move forward with, I'll say, reconstructing that bridge as soon as we can, because the environmental conditions are just uncertain.
Just to follow up on that, Marty, is it easier to work on that bridge when the ground is froze or when it's wet?
There's some work that really can't take place when the conditions are froze. There's some that can, but there's some that can't. So backfilling the abutments for existence with frozen ground just won't work. And so it's likely that we'll be able to permit the Snowmobile Club the entire season. But I just want to caution folks that if conditions allow us to move forward, we had a very warm winter last year. If that condition would happen again, then there's a possibility for us to move forward with it again.
And they're being optimistic that it's gonna snow enough that they can,
I'll leave that in Scott's hands. And so, again, the primary things here at this point in time, really, we just need a signed permit. They've provided us the insurance here this morning and the permit fee. So with that, Mr. Chair, I think I'll turn it over to Scott for any questions you might have.
Scott, welcome. Any information you want to share with us?
Well, yeah, it's gonna snow, so we're gonna have lots of doubters in the room. We're in a La Nina at this point, and La Nina brings lots of snow and cold to Minnesota, so we're hoping that's going to happen. Statutorily, the trails open December 1st and run through March 31st. So we'll be working with Marty exclusively before December 1st and see if we can get this project going. If we can't, then we are, planning on running on that trail and that bridge. Now, there is protections for the bridge. The bridge is a wood deck. The county provided rubber mats for us, and so we put the rubber mats down so there's no degradation of that wood material on the bridges. So we just have to work with Marty and the project engineer and the contractor when that gets let. But if we're seeing poor conditions into December that the job isn't going to get done, we'd like to utilize that trail system. So any questions for the
Yeah,
commissioner?
Scott, what kind of lead time does the county need or did you need to make the alterations to a different route?
Well, I've got a pretty good crew of workers. We can pop it in a day, probably, the trail markers. And this is our second year. The first year, you're always kind of, where should we put this sign, da-da-da-da-da, and there's guidelines, and then you have some signs, and then we added additional signs after the fact where there were some maybe areas that we could have done a better job. So, but with my crew, if I put the word out, we can get it done in a day. Any other questions?
Commissioner
Mr. Chair, Mr. Wakefield, do you want to talk a little bit about the signage and what the club does to keep the snowmobilers on the trail and to respect people's property, et cetera?
Yeah, well, we worked with Marty a little bit. Marty wanted and the park board wanted a trail signage plan put together. And so doing this for 34 years, I've gone through and put that together as far as no studs are allowed on this trail. The speed limit being 30, normally the speed limit's 50 in the state of Minnesota statutorily. So we reduced that to 30 going through town. So I've got that at the beginning and the end. Also on the map, when you saw the trail cuts off before County Road 32, we have no snowmobiling beyond this point. We added that. And then also in downtown New Germany, we put a big 3 4x8 sheets of plywood that say there's a trail reroute. You cannot access County Road 33 going north out of New Germany to Highway 7, that you need to go to the east side of town and work your way up that way to Highway 7. Then on Highway 7, we also have signs, 4x8 sheets of plywood, that state this is your only way into New Germany. Must turn left here. And that's, like I said, it's a huge sign that we put in there. We've totaled about $4,600 in signage, additional signage that we paid for to get this up to, the old joke used to be, why do we even put up signs if snowmobilers don't read signs? But you got to do it, and you got to overdo it, especially the first year, to get them to understand where the changes are. And so we went over the top in this case and spent extra money to do it so we don't have any problems in the future.
As a person who's run for office a few times, signs are expensive.
They are
And
expensive.
big signs sometimes attract attention, so.
Yeah, yep.
Commissioner
Anybody
Fahey,
else?
anything else?
I would make a recommendation, Mr. Chair, to approve the motion for the special use permit for the Southwest Trail Association.
I would second.
Okay, we have a motion and second. Now, any more, Commissioner Lynch?
Only that Scott and his crew, they put an immense amount of work on this. And when he says, and he's not exaggerating, they'll pop all these signs up in a day, and it'll be half a day. Their crew works tirelessly. I will say that it's the first time I've ever heard anyone at the podium bragging that the upcoming winter is going to be a lot of snow and cold.
Yeah.
First time for everything, huh?
Okay, that brings a question, as somebody that's been pounding in quite a few posts over the years, how do you pound in a post if the ground is frozen?
Well, there's two ways of doing it. One, you have a rebar pounder, which I had manufactured and made.
Right.
So it's like a post pounder with two hands on it. Or you pre-pound in a rod with a sledgehammer and then use that hole once you break through the frost.
Okay.
Yep,
Yeah, that's difficult.
it is.
You sound
Yeah,
like a
well, how
man
dr-
of experience.
Oh, yeah, a lot. And it's been so dry. Thank goodness for the
Yeah.
rain that we've had and the snow we've already had. It was just a little teaser, but the snow that we've already had this year to break that ground up. Otherwise, it's hard as a rock. It's concrete, as you know, trying to plow. So,
Other questions, thoughts? Commissioner Workman?
Well, I'm missing my ditch pickle that I had.
they probably don't even know what that is.
It doesn't
Commissioner
sound very
Fahey
good.
would know. Yeah.
Yeah, sure he does. But always good to help this group out. I've watched as Carver County from the east to west, has moved out, and you don't see a lot of snowmobiles driving on the streets in Chanhassen to get to a trail, maybe down by Commissioner Degler. But it's sort of like the vanishing wilderness, but so much fun to get out. I do always hope that we have nice snow and nice winter, and I don't know where these trails are going to the nearest pub or else, but food, always a fun time. So thanks for all you do out there.
Thank you.
Any other comments? We have a motion and a second. All in favor of that motion, say aye.
Aye.
Anybody opposed? Motion carries unanimously. Have a good winter.
Appreciate your support.
Like we used to always have.
All right. Appreciate your support. Thank you.
Mr. Chairman, the ditch pickle,
Please.
Arctic
explain.
Cat, very, very bright green snowmobile. My ZR 600, but went like a maniac, and I look really good on it. So thank you.
Thanks for that explanation. That visual picture. Okay, we need a motion to adjourn as a Carver County Regional Rail and convene as a Carver County Community Health Board.
So moved.
Second.
Motion by Commissioner Uderman, second by Commissioner Lynch. Any discussion on that motion? Hearing none, all in favor of that motion, say aye.
Aye.
Anybody opposed? Motion carries. We're now acting as the Carver County Community Health Board, and with that, we have a semi-annual report. Dr. Scott.
Commissioner Chair, thank you. Commissioners, county staff, appreciate it. It's always a delight to have an opportunity to present to this group of distinguished people on the state of the health in Carver County. I always have fun things to share concerning issues, but for the record, since this is voting day, I did wear purple because in my position, I exist at the privilege of the commissioners, and I'm also a nonpartisan position. So that is not entered into my decision-making or recommendations as we move forward. I know COVID unfortunately made public health sometimes a political issue, and I just wanted to reassure people that we are here based on what we know, what we understand, the best that we understand science, not always perfect, but we make changes as we learn more new information. And my recommendations to you will be based on that science and our discovery of understanding our community. So just for the record, I'm voting.
The other color I see is the red sticker. Where did you pick that up this morning?
I am a resident of Victoria, so precinct 4. So I was at the Lions Pavilion Park, where I did cast a
Was there a line?
I was there early, like I am for a lot of things. I was there about 20 minutes early. It was nice, but once it opened, it went very efficiently, very smoothly. People were very courteous and respectful.
And what number in the tabulator were you, if I could ask?
I don't remember that. I'll keep that in mind next time. Thank you for that.
I just mentioned that because it's the first time in my history that we had to wait outside. And by the time my wife and I voted, we were number 80. And that was at, like I say, 10 after, quarter after 7. So,
I had my umbrella in the car just in case, so I was prepared.
well, umbrella, you don't have to shovel it, that's for sure.
Thank you. So
Thank you.
moving on to the next slide. Do I control that? Just push the button. Oh, okay, very good. Well, as I've shared before, our vision overall for Carver County is a healthy people, healthy communities, and a healthy Carver for a lifetime. Public Health has sort of identified a mission statement. We strive to make Carver County a safe and welcoming place where everyone belongs. All people are supported to be healthy throughout their lifespan, and everyone can contribute to building a healthy and vibrant community. As you may recall from my June presentation, the results of the Carver County Health Outcomes, again, established that Carver County is one of the healthiest counties in Minnesota. We're fortunate to enjoy that. We've had that distinction for over a decade. We were also just recently recognized by U.S. News and Report as the 8th healthiest county in the United States. So we have a lot to be proud of. We also, though, have some concerns that we had discovered through the course of our comprehensive health assessment. I'll be sharing some of those as we go through that today. But as you can see here on this graph, less healthy counties are on the left, the healthiest counties are on the right. We're right up there. So it's always proud to be able to say that. What have we learned, though, through our comprehensive community health assessment over this past year? We have learned that we are still one of the healthiest counties in Minnesota, but we're also experiencing many of the same health issues that the rest of the country is experiencing, maybe not as severe as them. And we've identified the top 3 that we thought were major themes through our exploration and through our research and our evaluation process. One, health overall is declining. Again, less here in Carver County than across the country, but we are still having some concerns there. Mental health and affordability were raised as some of the top concerns when we surveyed our residents. And of course, as we all know, the Carver County population is changing. I'll kind of address each of these briefly as I move forward in my presentation. As I mentioned, the health in the United States is worsening. I think you can point out from the slide that the average life expectancy of Americans peaked in 2014 at 78.9 years, and then in 2022, it dropped to 76.1. While obviously a lot of this was contributed to COVID, it wasn't exclusively contributed to COVID. Now, fortunately, the average life expectancy in Carver County is 82.5. We're almost 3 years higher than the state average and over 6 years higher than the national average. Some of the causes of death besides COVID, like I mentioned, are increasing. These might include kidney disease, liver disease, diabetes. Those have all increased. Up until just recently, deaths by suicide and overdose were also beginning to creep up. We noticed, though, that the results from 2023 may suggest that that's stabilizing and actually starting to decrease. Yay. It's not where we want it to be, but at least it's going in a better direction. As we all know, COVID profoundly changed our world. It disrupted our lives, and it continues to do so. In Carver County, we had 159 deaths so far to COVID. Fortunately, we have one of the lowest fatality rates associated with COVID in the state and in the country, and I'm very proud of that. I think our partnership with Ridgeview, our clinics, our other partners have helped contribute to our rapid response, and as a result, kept our fatality rate down. But there's also other things I wanted to highlight a little bit today, since obviously we've had enough talk about COVID over the years, and I think I was given the directive by this group not to mention it, or only mention it limited amount of times when I have to. But a couple of things. One, we probably heard the news about measles outbreak, right? I mean, we had one back in 2017. We've had one recently. Fortunately, in Carver County, we didn't have one case of measles back in 2017. And so far, let's knock on wood, we haven't had any cases of measles this year as well. We think the measles outbreak might be over. The incubation periods have gone. We haven't identified any new cases for several weeks. So we hope they're over. But obviously, one of the most important things that we can do to address that is preventatively, is to make sure that all of our kids, in fact, all of us who haven't had it, get our measles. I discovered when I went to the doctor the other day that they had no official record of me having measles, mumps, and rubella, even though I know I had as a kid. I mean, I was a pincushion. I think I told you my folks were medical missionaries. We went on the road about 3 or 4 times. Every time I got shot, right? So I'm sure I had it, but I didn't have any documentary. So I said, okay, is there any harm in getting it again? The doctor said no. He said, well, shoot me up. And so we did. So it's MMR. So now I've got my most recent measles, mumps, rubella vaccine for a second time, probably a third. But anyway, having said that, measles was a concern in Minnesota, fortunately not for us. However, pertussis is a whole different ballgame, right? Pertussis whooping cough. We've had nearly 1,300 cases of whooping cough in Minnesota. In fact, we noticed a 25% increase just in the last couple of weeks, as of a week ago. Carver County was like the 3rd highest number in the state. We had 109 cases. So obviously, we're not immune, no pun intended, from having childhood diseases, so we have to stay on top of that. A couple of the other things that we've been concerned about is varicella, which is chickenpox. There was 128 cases in Minnesota. We did have an isolated outbreak in Carver County. Highly pathogenic avian influenza, often referred to as bird flu, is also an increasing concern. There are no detections in people in Minnesota, thank goodness, but it could be there. So we actually, I'll share a little bit of a fun marketing campaign that we did based on the direction of Minnesota Department of Health on that issue. And then the other one is cryptosporidosis, which is a parasitic disease. We did have an isolated outbreak of that. So there are some other concerns that we watch over, and hopefully no news is good news when it comes to public health, so we can kind of keep that at bay.
2 questions.
Sure.
The bird flu, is that more prevalent in the spring when birds are migrating to our area rather than in the fall when most of them are heading the other
That's
direction?
a very good question. I'll need to double check on that. I'm not the expert on that. I rely on Minnesota Department of Health to kind of give us the latest information on that. So that's a good question.
Okay, the other question is, do you expect our life expectancy to increase now that the pandemic, we'll say, is over?
I hope so. I mean, I think there's evidence now across the nation that our life expectancy is beginning to creep back up, and I would assume that we would hopefully follow suit.
Thank you.
So what was the other major key finding that from our community health assessment? And I mentioned it earlier, it was mental health and affordability. As I mentioned, COVID doesn't disrupt just our lives physically, but affects our social bonds and our mental health of our residents. The biggest change in 2018 community health assessment was the increase in mental health issues. According to our survey, 20 to 30% of the respondents felt isolated, lonely, on edge, nervous, or other unwelcomed emotions. And we also had a high percentage of people feeling a sense of hopelessness. So obviously some concerns there. What we also discovered is what we often refer to as the social drivers of health. We asked what was the biggest issue affecting health in Carver County, and residents ranked the cost of health care and health insurance as the 2 biggest factors affecting their health. They also ranked the cost of housing as number 4. And we have learned that income, poverty, race, home location, gender, and many other factors do affect health outcomes. Some people refer to these as social determinants of health. I prefer to use the phrase social drivers of health. Determinants implies that it's sort of fatality, or it's fatalistic. It's like, this is going to happen. And we have seen from our work that can be reversed, that can be changed, that if we address these issues in a proactive way, we can actually improve health, improve people's participation in their community. And so that's sort of been our focus. The third area of concern, again, is well, it could be a concern, it may be positive, it may be challenging, is that the population of Carver County is changing. We're growing, we're getting a little older, we're also increasing in our diversity. And how we address this key issue, I think, will determine whether or not we look at this as an opportunity and an advantage, or if we look at it as increasing concerns and hardships. We have a choice in how we respond, and I think it could be one or the other. So I'm very hopeful about the increasing growth and aging and diversity, and how we can use that to our advantage to make this an even better place to live, learn, work, and play. Before I go into what we're hoping to address in the future, I wanted to take a little time to celebrate where we've been this last year. When I have the opportunity to be reflective on our accomplishments, I get goosebumps, right? I become so proud of the opportunity to work with such a high-quality staff and our partners, both internal partners and community partners, because together we are really moving the needle on some essential areas that will allow us to continue to be that healthiest county. We saw an expansion in our response to vaccine-preventable diseases, like I mentioned. We did a campaign that raised the percentage of young people who have measles, mumps, and rubella from 83% over the course of 1 month after a marketing campaign and outreach, working with our schools, working with our clinics, offering clinics here in the county government, as well as other locations, including with our partners with CEA. We also continue to work with a Public Health Advisory Committee to identify the key priorities and focus for the next 5 years. I'll be sharing that briefly later. We expanded partnerships with local partners to serve our community and reduce health disparities, working with the very people who are the most affected, having them to be an opportunity to contribute to their own health. And we enhance the capacity to address food security, mental health, older adults, opioid and substance use disorder, and enhanced public health education. One other thing I want to say here is that many of you have had the opportunity in our food distribution events. Many of you have been involved in supporting our food shelves. And I just want to say that among that, we collaborated with community partners to provide 91,756 pounds of food, which is equivalent to over 76,000 meals through the free produce market. Over 700 unique families participated in this program during the summer at Norwood Young America and Chanhassen. And that was an average of 250 family meals a week. The program activated 130 volunteers, contributing well over 1,200 hours to support the program. And when we did an evaluation on what its impact was, this is how they responded. 91% of the households ate more fruits and vegetables. They were finally listening to their parents, right? Eat more fruits and vegetables. 88% of the households eat healthier, indicated that they're eating healthier now because of participation in the program. 95% of them said they had less financial stress because the additional support from food allowed them to use that money for other important items, so they felt less stressed. And 92% of households can better cover their other expenses as a result. One other program we worked with as it related to food was with the Carver County Environmental Services to pilot a food rescue program at the Chaska and Carver Farmers Market, diverted nearly 3,800 pounds of food from the landfill, and then redirected that healthy, otherwise perfectly good food to a Bountiful Basket food shelf to help address food security. So it was a win-win on both reduce food waste as well as address the issue of food security.
With that photograph, I have to ask, what's the logo, or what group is that?
That's public health. This is a few years old. We need to
Okay.
update this, because there's some of the staff there that have now moved on to other positions. But this was one of the T-shirts we used at the county fair, and I think it's Health is for All. But we, in preparation to kind of have that unified front to promote public health, we offered staff an opportunity to wear a T-shirt at the county fair, and they can wear other places too. But yeah.
Yeah, thank you.
I know, I need to update this. I asked my
No,
staff, do we have a newer picture that includes most of us? And they said, no, we need to do that, so. But this one is cute, right? This is an example of our enhanced messaging capability. This was in response to a request by Minnesota Department of Health to solicit our help in addressing the increasing concern about the risk of bird flu. We utilized one of our communication partners to help craft a postcard, and we were able to send out to the farmers operating a registered feedlot. And the target was farmers, farmer workers, and farm families of all sizes, whether it's backyard to large operations. And of course, my favorite response to some of our internal polling on this is Oh, it's so cute. Anyway, that's why I thought I'd just share it as one example of how we're trying to improve the quality and the effectiveness of messaging in order to make a difference. I already alluded to the impact that we had on childhood vaccinations as a result of our outreach, and we hope to continue to do that as we move forward. So where are we going as we move forward? Well, I think across the whole nation, and COVID helped stimulate this, we're reevaluating the need to reinvent public health. We need to ask some tough questions on what do we really need to do that matters, that will have the optimal return on the investment of the public dollar, right? And what can we let go of? Public health does not need to be involved in everything. We could be, but we probably don't need to be. So where do we really need to focus to get the biggest impact from our event? And that's what this has helped create, those public health foundational responsibilities. They have now been incorporated, or they're in the process of being incorporated into law. The previous ones are part of law. We look at public health as the principal provider of populational health issues, not necessarily clinical practice, although there are times where public health has to support that. We support River Valley Health Services that provides medical care for those who do not have insurance as a door into the system so they can access other care to help keep them healthy. We need to be populational based primarily instead of individual based like health clinics are. We need to focus on disease prevention and protection, more upstream activities, but that also could mean how do we mitigate risk? How do we help with getting people back into the community after treatment or other issues, but it's mostly focused on prevention. And then the core capabilities and program areas, and I'll probably talk a little bit about that as well. So this I shared last time. This is the process we use to go through the community health assessment that provides the foundation and the data necessary for us to develop a community health improvement plan. We work with the Public Health Advisory Council to do that, which is representatives from across the county, all jurisdictions, different ages, different backgrounds to help us do that. And with that program, we identified the two top priorities that the community will be involved with. Now, public health itself will have many more, but our participation with the community, the two top areas were going to be mental health and those key social drivers to health, housing, transportation, and food security. So this is what the community says. We're willing to help you address these. So again, it's a way of leveraging the resources in the community, not using taxpayer dollar, but leveraging the resources, talent, and funds of the private nonprofit sector to help address these things together so we can create that synergy to address the very things they identified as being the most important. One of my favorite quotes is people support what they, I forget it, right?
They know.
People support what they help create. I think Roosevelt was actually, Teddy Roosevelt was originally charged with saying that quote. But when people are part of the solution, when they're part of identifying the issue, identifying the solution, they're going to be right there to help you, and they're going to give it 110%. So that's a principle we use as much as possible, again, to leverage the support of our community.
That kind of goes along with the question, a couple slides earlier, you mentioned population-based. How many population-based, how many different bases are there? How many different populations, I don't know how to word it even, are you identifying?
It's a very good question, and actually there's 8. And I can just, right here, well, there's 5 here. Okay, so there's 5 areas of foundational areas of responsibility: communicable disease, chronic disease and injury prevention, environmental health, maternal and child and family health, and access and linkages to critical care. And then the way we do that is by having 8 approaches, which we call capabilities. In other words, we strive to get really good at those 8 things in order to address those 5 areas. So we want to get good at assessment. We want to be good at partnerships. We want to be fair and equitable to all of our residents. We want to have organizational competencies, that's process improvement. We want to develop policy, work with you folks on what are those policies that provide the support to make it easier to be healthy. And that's what we focus on as well. Accountability and performance management. We need to be accountable to you. We need to be accountable to the taxpayer. We want to do our emergency preparedness, prepare for the next pandemic, but maybe it'll be something else like a power outage or a flood or something like that that might be more likely to happen. What role can we play? And then, of course, getting better at communicating what's important and to have buy-in so that the community can help us be part of the solution to our issues. So that's, when you say that's a very good question, that's the illustration or the graphic that sort of outlines what we're responsible for.
Thank you.
Again, so as I mentioned that, so just what are those priorities for change that we're seeing as a result of the work that we're doing with our community? Well, we need to prepare, adapt, and respond to populational growth and changing dynamics, like I mentioned. We need to improve awareness, access, and utilization of what I call culturally responsive and affordable physical and mental care. We want to be able to speak the language of the people who need the service, whatever that might be, so that we can be responsive and solicit their involvement in helping them become healthy. We want to improve capacity to respond to future public health emergencies. We want to expand new and existing, enhance existing opioid and substance use prevention. I'm very excited about how we can leverage the funds from our opioid settlement, combine that with other funds to address the needs that people in our community, both internally within Carver County, as well as externally, decide on how to help address the issue of substance use and specifically opioids. And we want to strengthen our capacity to prevent communicable diseases, chronic illness, personal injury. And then we also will be incorporating the new Minnesota Infectious Disease Operation Guide. And if you want some light reading for evening, I'd recommend you can download this out. It's just been released recently, but we will be studying this and using this to outline how we will continue to address our infectious diseases in Carver County. Again, just to start wrapping up, this is a list of the program areas on how we address those other priorities. We talked about community assessment already. Obviously, we have a whole Healthy Families program, a home visiting program. We're a part of the statewide health improvement partnership, which allows us to work with schools and businesses, our aging community. We have the Office of Aging and Senior Services, which is unique. Many public health agencies don't have that. And this board helped establish that almost over a decade ago. We have substance use disorder prevention. We're served as the chief strategist for the opioid settlement. We obviously continue to address communicable disease prevention and control. Immunization is just one part. Preparation for emergency preparedness. And then what I'd like to say is all of this falls under what we're doing is considered communities of belonging. And because why we feel that's so important is that drives the value of all of our work. If we can cultivate communities of belonging where everyone is valued, respected, and supported to achieve their optimal state of well-being throughout their lifespan, from pregnancy to passing on, and then where everyone can contribute also to be a part of that in the creation of a healthy, equitable community for all. That's why we do it. We want to make this place continue the healthiest, happiest place to live, learn, and work. So with that, I will open up to any questions that you may have.
Other questions for Dr. Scott? Commissioner?
Mr. Chair, Dr. Scott, sometimes we talk about socioeconomic disparity. And I know that it comes up a lot in Carver County, most affluent county in the state. There's a lot of gap between the has and the nots, particularly in the last 4 years, particularly with inflation. What are we seeing in the county and how are we addressing it? And I don't expect you to be the answer, but I just want to know the context of how you see it with regard to health, because I know money's tied to health.
Well, I wouldn't be able to answer specifically without checking my numbers as far as where we're at with median income.
Yep.
And how that has changed immediately. But obviously, as public health, we're concerned about the health and welfare of everybody, but we're specifically charged to work with those that are the most vulnerable. And that can include those that live on little. And so we do target our programs in order to be responsive to their needs. And it's often filling in the gaps. We don't want to reinvent something that's already out there, but when there's gaps in the service, it prevents them from accessing other resources. We want to fill that gap. And by filling that gap, now they can be part of the community and access the wealth of resources the rest of us enjoy. And then that way that improves their health, it improves their community engagement. They can take a more active role in continuing making this a great place to live. And that's how we feel it's more both cost effective, it helps them thrive, builds better relationships, and just makes us a better place. One example is a program that we're going to be using opioid funding to help our housing program, because we have a very robust housing support program, but there are gaps where we're missing. Like, you know what? We don't have this, so that prevents these people from accessing this. If we had a little flexibility, minor amount of money, but yet programmatically a huge abyss, we can fill that, create that bridge. Now they can access this program that allows them to get a job, that allows them to, to eventually have stable, affordable housing. And so it's those kinds of little pieces that fill in the gap that we often focus on. Because I'm not sure if that addressed your question.
I'd want to dive in a little deeper, but you help me on the surface level. I know that Rod built a great foundation. Heather's taken the torch. Her team has tested and tried a lot of things. We closed a gap ministry, at least in the short term, for automobiles. We've never done that before. But we have the big question mark as to who gets to fund it next if we continue it. Is it worth it? Did the pilot deliver the result that we wanted? We see the same with the Navigator program, leveraging our not-for-profits and our civic organizations, our places of faith. We see Oak Ridge. And there's a purchase agreement on there now, and there's potentially 200 beds that have been sitting out there for over 3 years in partnership. It's happening. Like, these things are happening, but we're putting a lot of pressure on our not-for-profits. I was with a couple of them in the last 2 weeks. Some of them are reporting 4 to 10 times more usage in the last 3 or 4 years. And that's not sustainable. And I talk to people that say, okay, if you're trading down from Lund's Byerly's to Target to Cub, where does the guy or gal that's going to Aldi trade down? The answer is us, or it's being absorbed for the not-for-profits or the churches. How are we supporting them? Because they're the ones that are sharing that burden. And I think it's the $100 million plus of philanthropic activity that leads every year Carver County to voluntarily give to the not-for-profits to help serve that needs, and we stand in the middle to help coordinate some of that. And so I think that it's fair to say historically in the last 2 years, we've done more with our not-for-profits and gotten more out of them. And I think that's part of the answer, not just for us to hoard ourselves and make work here, but also to lend to our peers that are in surrounding counties. So thanks for your efforts.
Other questions, Commissioner Fahey?
Richard, just thank you for the update. Always appreciate that. And just the various events and all the outreaches that you and your team do. Just being involved with the community belonging in Cologne. My wife is very active in that committee, and when she's active, that ultimately ends up myself getting pulled into various events. And then I've worked at multiple food distributions in NYA, and it's just really meaningful to see that happen, and just, you feel good. It's just the heartfelt that you're helping all those people with that food distribution. So thank you.
Other questions, thoughts? Well, thank you, Dr. Scott. Public health has come a long way. I mean, my first connection with public health was, I think, standing in line to get a polio shot as an elementary kid. And then they graduated to the sugar pills. But that's, now you're so broad and affecting lives of everybody in so many different areas. Thank you. With that, we're coming to the point where we adjourn as the Public Health, Community Health Board, and reconvene as the County Board.
So moved.
Motion by
Second.
Commissioner Lynch, second by Commissioner Uderman, to adjourn and reconvene. Any discussion on the motion? Hearing none, all in favor of the motion, say aye.
Aye.
Opposed? Motion carries. We're now back to the County Board. And Administrator Hemsey, anything to report?
Just a couple notes, Mr. Chair, board members. Next week, you have a series of joint ditch meetings. I know you're all excited.
That's something new for Carver County.
Well, we've never held so many. Of course, we're going through the redetermination. But it is a bit confusing. I think we all know that. Krista sent out a draft agenda. I followed up and sent a list of which ditches, joint ditches you're on.
Thank you.
And we're going to consolidate both those. Right, Krista? And on the final agenda. And you'll notice that, of course, there's different times for these joint ditch meetings. That's intentional. We think some of them are going to be much more well attended than others, so we're trying to avoid crowd overlap, et cetera. So if you have questions, actually Dave Frischman and Krista are handling that mainly. But circle back to us if you have questions.
So who's going to that ditch
Workman.
meeting?
Huh?
There's a series of them, Commissioner Workman, and I sent a couple emails. I think you
Okay.
might be on one at 10 o'clock, if I'm not
That's
mistaken.
telling me it's a 10 o'clocker?
Yeah, you have to double check the schedule.
Okay.
I just sent it this morning.
Okay.
And we also have, of course, the Carver County Ditch Board. That that's not necessarily the joint ditches. We'll have some meetings come up later. So again, confusing. We usually don't get into these things as much as we do. So we're trying our best to sort them out. Secondly, Kendra this afternoon will be sending everyone an email, all of you, an email giving you links to the key election sites for results, Secretary of State site for our local and federal elections. She is saying, don't hold her to this, but she thinks by 10 o'clock, maybe we'll start posting results. And of course, that's going to be delayed a little bit. Usually we're earlier than that, but well, maybe not. In past, maybe 9 o'clock. But because of the change in the absentee ballot voting timeline, et cetera, she's hoping 10 o'clock, but of course, the more important thing is accuracy. So that's what those staff are working on. And what I'd finish by saying is extending a thanks to that group. Well, I'm hearing about some awful long days. And many of these changes we hear about, I think one of the implications is a lot of staff time going into the elections process, which is a good thing. But I think let's recognize how hard work that is. And I'm hearing some 14-hour days being put in, et cetera. So it's coming to a conclusion, but when you get a chance, make sure you extend your thanks to that group.
Yeah, they had yesterday, a long line in the government office building here.
Yeah, I'm hearing today, it's wrapping around for quite a ways.
Anything else that should be brought up this morning?
No, sir.
If not, is there a motion to adjourn?
Second.
Motion by Commissioner Workman, second by Commissioner Lynch. That's a motion that doesn't have any discussion, so all in favor of the motion, say aye.
Aye.
Opposed? We are adjourned. Thank you.